So this is our extraoral assessment. One of the first things that we need to be sure to do is explain the procedure to our patient and gain their consent. So we always inform before we perform. So Ms. Cruz has volunteered to be our patient. Ms. Cruz, I'm going to begin by doing an extraoral cancer screening. If at any time while I'm in there kind of palpating and touching different areas of the head and neck, if anything's sensitive to you, just let me know. Okay? All right, so normally, guys, you would be in full PPE to do this assessment, but I have learned through doing these videos that when I put a mask on, it's really hard for you to hear me on the video, so we're gonna go mask-free, break the rules a little bit here for the sake of educational purposes. I'm actually gonna take these off as well. You guys would be wearing glasses, a mask, your blue gown, as well as gloves. So I'm going to go ahead and put gloves on. And one of the first things you want to do with your patient, even before you get into the extraoral assessment, remember from the lecture when we talked about even watching the way your patient walks, watching their gait to see if there's any unsteadiness, uneven symmetry, if they had any, issues coming in with crutches, a cane, a wheelchair. Those would all change your process of care for your appointment. One of the first things we're going to do as well, I'm going to raise her up a little bit. Is we're going to look at the general facial form and symmetry of our patient. So we're going to make sure that the eyes are equidistant, that we have a good midline between our lips, our nose, and our forehead. We're going to look at the eyes for their color and for their symmetry. We're going to look for any lumps, bumps, lesions, moles, scarring, freckles on the face that may indicate something unusual or abnormal that we would need to do a lesion description for. I would also look around my patient's hairline to see if I see any of those freckles, scarring, lumps or bumps. I'm going to look behind the ear. So you physically have to move your, can you see me over here? Okay, you have to move the patient's hair. And if you'll turn a little bit to the left, Ms. Cruz, thank you. We're going to pull the ear back so I can actually visualize and look behind the ear. You'd be surprised the amount of patients that you could find some sort of mole or scarring on. I'm going to move her hair off of the back of her neck and look back here for any issues that will require a lesion description. Pull back the other ear as well. And then from here, since I don't see anything that requires a lesion description, I'm going to go ahead and point out the structures of the lips, and then we'll move into lymph nodes. So when we're looking at the lips, we're going to look at the vermilion border. Remember, if the vermilion border was to deteriorate or the line between the lip and the skin wasn't well delineated, that could signify we're looking at some sort of skin cancer or a potential movement in that direction. We have the labial commissures on either side, the tubercle, and the philtrum, which is the little dip in the lip. Okay, so the next thing I'm going to start is palpating lymph nodes. And you guys are free to do this in any order you want. My order doesn't have to be your order. You just do what's best. The first lymph nodes I like to palpate are the clavicle, and I always tell my patient what's happening before I do that. So Ms. Cruz, I'm actually going to start by palpating the lymph nodes right here on your collarbone. Okay. We palpate the supraclavicular nodes. So what we're going to do is feel on either side, and we're going to do a rolling downward over that collarbone movement. I'll show that once again. Okay. The next place I'm going to go is the occipital nodes. And I know this is going to be hard to see in the video, but I'm going to come from behind. I'm going to find the midline up in about 2 inches up into the hairline. And I'm going to push and palpate in a circular motion. So that's your occipital nodes. Ms. Cruz, I'm going to turn you a little bit this way towards the camera. And the next thing we're going to do is our auricular. So they're going to be here in front, the preauriculars in front of the ear, and our postauriculars behind the ear. So again, I'm going to use a circular motion, applying a good amount of pressure so that I can feel any abnormalities. circular motion in front and behind the ear. So we will as well do the right side. Preauricular, then coming behind the ear for the postauricular. The next place I'm going to go is the cervical lymph nodes. So if we actually have Miss Cruz turn to the right and tilt her chin down, you'll see her sternocleidomastoid muscle protrudes very nicely. So two things here. One, I need to palpate the muscle itself. And the second thing I will do is palpate the nodes that are on either side of this muscle. These are your cervical nodes. So I'm doing a rolling motion over the muscle for the pre-cervical, and then a rolling forward over the muscle for the post. Let me show you again on the other side. So tilt to the left and down, over the muscle for the post, back the direction you came for the pre. Okay, don't feel any abnormalities there. The next place is our submandibular lymph nodes and our submental lymph nodes. So what we're going to do for the submandibular is we're going to use, I use about 3 fingers minus the pinky on each hand, and I'm going to apply a pressure underneath her jawline, and I'm going to roll up and over. Doing the left side right now, up and over the jawline. Again with the right side, up and over for the submandibulars. Our submentals are right here in the front. There's actually one on the left side of the midline and one on the right side of the midline. So I'm going to use both hands and apply pressure in a circular motion, and I can roll up and over the jaw. There's a couple of muscles we also want to palpate. One that we already did, our sternocleidomastoid. We're going to have Miss Cruz clench her teeth together, and we're going to palpate her masseter. We're doing a pressure motion with a circular motion. Her temporalis, again, pressure with a circular motion. And her mentalis. Good, you can stop and release. The other thing we want to palpate is her parotid gland. So we're going to go ahead and have her clench together one more time and release. And if we had a parotid gland that was, let's say, blocked or building up stones or anything like that in it from a pathology standpoint, we would feel that. We also want to palpate the sublingual gland. So Miss Cruz, if you will just put the tip of your tongue to the roof of your mouth. Again, I don't feel that gland pushing down or pulsating. Everything feels normal, and you can relax. And then we also want to palpate and find her thyroid, which is the butterfly-shaped organ right here. We're going to find that thyroid, and you can see the technique that I'm using. I'm actually going to wiggle her thyroid around to make sure it moves. And then, Miss Cruz, if you wouldn't mind swallowing once for me. Nice. And if your patient had an abnormality, what you may feel is that your hand may one hand may pulsate out and back. If they had, let's say, a lesion or a tumor or a growth. So you can use one hand to palpate the thyroid. You could even use 2 if you wanted when you had your patient swallow. Right below that butterfly-shaped organ is that larynx. And I'm just going to feel up and down there and make sure I don't feel any lumps or bumps or anything that shouldn't be there. Everything feels fine with the larynx. And the very last thing we're going to do is we're going to check her motion of her TMJ. So we're going to want to find where her TMJ muscle is. So what I'm going to have you do, Miss Cruz, is go ahead and open and close for me. Yes, and I can feel that my fingers are right over that joint. So she opens and closes. Good. Now you're going to open and move your lower jaw side to side. Good, you guys, that's called lateral excursion. Go ahead and relax for me and move your lower jaw forward like a bulldog. That's called protrusion. Lastly, we want to check range of motion to make sure your patient can open their mouth adequately. We use the 3-finger test per Jill Neal. So Miss Cruz, if you'll just go ahead and open as wide as you can for me. I'm going to check real quick. 3-finger test. Everything is great there. So you guys, that is your extraoral assessment and examination.